Dual esterase is used for the diagnosis of which AML? Option A M2, option B M4, option C M3, option D M6, and the answer is option B M4. All are causes of lymphoid leukemioid reaction except option A IMN, option B tuberculosis, option C whooping cough, option D pneumococcal infection, and the answer is option D pneumococcal infection. Which of the following are features of multiple myeloma? Option A markedly elevated ESR, option B hypergammaglobulinemia, option C Bence-Jones proteinuria, option D all of the above, and the answer is option D all of the above. Which coagulation factor deficiency causes hemophilia A? Option A factor 3, option B factor 8, option C factor 13, option D factor 9, and the answer is option B factor 8. All are features of ITP except option A thrombocytopenia, option B splenomegaly, option D decreased megakaryocytes in bone marrow, option D bleeding tendencies, and the answer is option C decreased megakaryocytes in bone marrow. Which of the following are causes of disseminated intravascular coagulation? Option A amniotic fluid embolism, option B AML M3, option C shock, option D all of the above, and the answer is option D all of the above. In hemophilia, which is correct? Option A prolonged APTT and normal PT, option B APTT and PT prolonged, option C APTT and PT normal, option D none of the above, and the answer is option A prolonged APTT and normal PT. All are features of CLL except option A moderate leukocytosis, option B thrombocytosis, option C lymphoadenopathy, option D smudged cells in smear, and the answer is option B thrombocytosis. Hemolytic anemia is common in malaria due to option A P. vivax, option B P. ovale, option C P. falciparum, option D P. malariae, and the answer is option C P. falciparum. Which WBC is characteristically increased in malaria? Option A monocyte, option B neutrophil, option C lymphocyte, option D eosinophil, and the answer is option A monocyte. Multiple rings within RBC is seen in malaria caused by option A P. falciparum, option B P. vivax, option C P. ovale, option D P. malariae, and the answer is option A P. falciparum. Which of the following are methods to detect malarial parasite? Option A thin smear, option B thick smear, option C quantitative Buffy coat, option D all of the above, and the answer is option D all of the above. Heinz bodies are formed in the following conditions except option A unstable hemoglobinopathies, option B alpha thalassemia, option C G6PD deficiency, option D lead intoxication, and the answer is option D lead intoxication. Hemolytic anemia can be associated with all of the following except option A plasmodium, option B syphilis, option C herpes simplex virus, option D mycoplasmal pneumonia, and the answer is option C herpes simplex virus. Diagnostic test for paroxysmal cold hemoglobinuria is option A Harm's test, option B osmotic fragility test, option C Donath-Landsteiner antibody, option D Coombs test, and the answer is option C Donath-Landsteiner antibody. Phagocytosis is the function of option A neutrophils, option B monocyte, option C both, and option D neither, and the answer is option C both. All of the hemoglobins are present in the normal person except option A HbF, option B HbA2, option C HbA, option D HbD, and the answer is option D HbD. Hematopoiesis in a 10-year-old patient with sickle cell anemia and hemolysis proceed in the option A liver, option B red pulp of the spleen, option C thymus, option D marrow of axial skeleton, and the answer is option D marrow of axial skeleton. Hemophilia B is due to the deficiency of option A factor 8, option B factor 9, option C factor 11, option D factor 5, and the answer is option B factor 9.